into the brain stem and then gets sent up to the brain. So as that gets sorted out, it's processed and then sent back down to the limbs so that you're able to move. As the brain processes all the information, it has to react quickly to tell the body what to do in order to keep balanced. Now, neuropathy can definitely be controlled in many cases, and it can even be reversed. So neuropathy is a progressive disease, and if it's not controlled, it can only get worse. Now, why are we talking about balance and neuropathy? Because if you don't feel anything in your hands and feet, then you're going to start to have these balance issues. So that is the correlation between neuropathy and balance issues. Like we said, the number one cause of accidents over patients in over 65 are falls. How can we reverse this, or how can we treat this? Well, one of the things that we use in our office is a thing called the Rebuilder. This uses nerve regeneration, and how it does that is, I'll tell you about the process. Well, nerve regeneration itself is a definite possibility, especially with younger patients. If they're non-smoking and if they have controlled blood sugar levels, this makes it a lot easier to control. But we found that patients who suffer from nerve degeneration and not impingement issues or nutritional deficiencies can still have a positive outcome. This takes a little longer than the more common types of neuropathy, but nerve regeneration, when properly supported by appropriate changes in lifestyle, can be effective in anywhere from 30 to 90 days. So what is a rebuilder? We have a special machine called a rebuilder. And just like it says, it rebuilds the nerves. The rebuilder it's a microprocessor that's designed to help rehabilitate dysfunctional nerves. And when used to treat patients with peripheral neuropathy, the pads are placed on the bottom of the feet. So we actually have the patients with these electrodes, and their feet are going to go into a bath, and little pads are on the bottom of the feet, or actually in the water, and these electrodes are going to be attached to a machine. And this actually sends information down here. It's going to go up one leg, across the spinal cord, back down, and the machine is actually going to be able to tell what's happening. So the treatment goes from one pad or 1 foot and up the leg to approximately the L4 or L5 level, and that's the lumbosacral area. And if there's no electrical effect at higher spinal levels. When the rebuilder is turned on, it measures the patient's electrical analog resistance and digital impedance, and it sends out parameters for their particular physical mass. Now it knows if it's actually targeting a 125-pound female or a 350-pound male. Now it sends out a test signal that represents the common waveform length in a healthy person, and then it waits for an echo-like transmission coming back, or a response from the initial signal. This waveform response is recorded and analyzed, and then any kind of aberrations are determined. So how do we fix the problem? Well, the first thing to do is to call my office. Second thing is make an appointment. Third thing is you want to bring a pair of shorts and a t-shirt for the exam. So let's go through that here. Call office. Make appointment. Bring t-shirt and shorts so that we can go through the exam. The next thing we want to do is actually have the exam. And then we're going to go through a report of findings. And when you come in for your report of findings, when I tell you what I found, it's always great, and I insist on you bringing your spouse, because whoever's going to help support you, and I don't mean financially, but I mean whoever's going to help you support you in your decision to be healthy, they need to be there to understand what's going on and the types of things that you're going to try and go through. So the next thing we're going to look at is food sensitivity and other lab testing. And then we're going to have an appropriate plan, which may include rebuilder, brain-based therapy, or other chiropractic types of treatments. Now we can't forget to change the diet and to include nutraceuticals in order to heal the gut and then to correct the rest of the problems as well. Last but not least, what we want to do is exercise. Very important. Okay? So, I have an offer for you. I normally charge $200 in my office for a consultation and examination, but if you call my office and make an appointment after seeing this video, then your charge will only be $60. And I will also treat you for 2 additional visits at no charge. The reason for this is because I want to see first of all how you react to the treatments, and I want you to see the types of different therapies and treatments that we do in our office, and then you make the decision. Is this right for you? So I want you to be committed. There could be a charge for this. Your insurance might cover a portion of it, but you've got to be committed. You've got to be willing to make a change here. And this is up to you. So whenever you're ready, when you're committed, then you go ahead and call my office at any time at area code 802-230-4678. So once again, my name is Dr. Tager, and thank you for listening to me today. And if you have any questions, feel free to give us a call or drop us an email. Thanks a lot. Have a great day.